Hey, Mandy, how are you today?
I'm good. How are you?
I'm great. Nice to chat with you again. And if you're watching this, which you are on YouTube, thanks for watching. We're here with Amanda Smith, and uh, I'll let you introduce yourself. You're with a really cool organization that's doing some really great work. Could you just share a little bit about you and what you do?
Absolutely. My name's Mandy Smith or Amanda, either one. I work with Ohio Healthcare Association. I'm the regulatory director there. I've been with the organization or the association for 10 years. We are the largest long-term care and post-acute care association representing those industries in Ohio.
Mhm.
We have almost 1,200 facility or provider members, and we have over 300 vendor members
Mhm.
representing the majority of the state. So
It's a busy group. It's an active group. You were sharing some of the numbers earlier, and when we talked before. And what is, a membership-driven organization like this? People that have been focusing on these things for years. There's a huge body of knowledge. What is you know, what are you providing for the members? You're providing thought leadership, but like, who are you to these members? What's that relationship like?
well, our membership is very ingrained and built over years. So part of the association, we're small but mighty. We are a slim staff of
All good things are, right?
10 to 11
Small but mighty.
employees, but we have a very long tenure. So you get to know our staff, you get to know our organization, and we really do care about what we do and what we provide our members. So what else did you ask me? I forget.
Yeah, you're providing services to them.
Oh, so
You're
what we're known for, I
sharing
guess.
information. Yeah.
Yeah, we're a leader in education, so we provide our membership education on the changes that are constantly hitting our industry. And the only thing that doesn't change about long-term and post-acute care is that it is always changing. So
Right.
we have the Education Foundation of OHCA, EFOCA, and we do over 300 educations a year. We also offer scholarships. We've offered over $2.5 million in scholarships to those who want to continue on in the industry. But we're also a very strong advocate. So legislatively, we have a strong lobbyist with Todd Bergdahl, and Pete Van Runkle, our executive director, is also very strong with lobbying for what our members need. Ultimately, if we're providing quality care to our residents and we're reimbursed appropriately for that quality care, we're doing what's best for everybody involved. So.
I've been following the LinkedIn posts, and you mentioned some of those things, the regulatory updates, and even some things on, what are the standards and what are the standards in care, the measuring tools being used, even which are, you mentioned change, besides actual developments in care, how they get accounted for and how they get measured and the standards there. Do you want to chime in on any of that? Because that's moving
Well,
only
that is
faster,
that
right?
is the kind of the answer that you can't answer because it's so much. We're regulated in all aspects. Currently with COVID right now, not only do we have regulation through the state, so we have Ohio Department of Health, Ohio Department of Aging, Ohio Department of Medicaid, but we also are regulated through CMS. So we've got HHS looking over and pushing down the federal regulations, but then also we have to maintain CDC as well as OSHA. So there's,
A
and
long list. I mean,
yeah, that's just, the tip of the iceberg because there's so many regulations that hit our members, and trying to understand and keep up with all of those is really a monumental and sometimes impossible task.
something that we in our group see a lot, working with founders, working with administrators and practices, working with surgeons, doctors, caregivers of all different kinds, is there is immense pressure and fear on what if I step out? What if I do something wrong? What if I miss something? Um, that layer of understanding and comfort in knowing you have an organization that's really vying for that, to make sure that no one wants to do things wrong, no one wants to, but to keep up with all that. I know that the pressure can be immense. So I feel like that's what's having a really good partner like that team, like your team, is doing for your members. You mentioned, and I mentioned the LinkedIn posts and some other things, but where is kind of the active spot for members to participate? You're kind of on all the platforms right now, right?
Well, we have our main website, so ohca.org. We have a COVID section. So if you're on our website and you go under regulatory, the very first thing you'll see is COVID-19, and that's where we post all of our COVID bulletins. We've been updating our bulletins daily. So since the beginning of this pandemic in March, we have pretty much been doing a daily bulletin. Occasionally, if there's not any hot news on the weekends, we may take a Saturday or Sunday off, but pretty much every day there's a bulletin coming out. Every Friday, we also do our news bites that are sent out to our entire membership, as well as the bulletins, which are sent out to our entire membership. But then we also have a very strong presence on Twitter, on Facebook, on Instagram, on LinkedIn. And that's really where we're trying to communicate with our members what other members are doing. So if you have a great idea or maybe you don't think it's a great idea, something
Have an
that
idea.
tried,
We'll decide later if it's great, right?
yes, yes. A lot of times people are afraid to tell us what they're doing because they don't think it's one of these, incredible ideas. But every idea that impacts a resident and assists your staff is a great idea. So we just try to share those and get that information out as much as we can, as well as sharing all of the changing in regulations and updates. We're going to try to put some videos together to, get quick snippets out. But just anything that's hot and new, we're doing that. On top of that, we're doing weekly member calls with all of our divisions. So, we have a home care and hospice call weekly. We have a skilled nursing call weekly, an assisted living call weekly, an ICF IDDD call weekly. So we're really trying to hit everybody with what they need to know without all of the extra information that they may not need to know.
Summarizing key executive summaries and such. That is a long list. I'm almost out of breath right now, frankly. That's a lot to keep up with. Back to the tenure thing, knowing that it's a small, passionate team that's obviously very ingrained in what's going on here. They've been there a lot of years. You've been there for a while. Maybe to kind of wrap up, share, how did you get involved? Why this? Why this? How did you get here? And what's the passion driving you and all these, million things you need to do to support the members? How did you get into this field?
Well, it's crazy because I have a lot of credentials behind my name. People like
It's
to
long. I'll put your LinkedIn in here, but yeah, all those traumas.
That is longer than my actual name, Amanda Smith.
It tells quite a story, right?
Yeah. My past life, as everybody likes to say, was in therapy. So I started out as a physical therapist assistant. I worked with the Columbus crew doing massage. So I went back and got my massage license. I then was working in nursing homes a lot, doing physical therapy. I became a regional, and I really like the MDS, which is one of our metrics where we are documenting all of the information for residents, and it's used in billing. So I got certified in that, and then I decided I wanted to make a change from within. So I went back and got my nursing home administrator's license. During all of this, I worked, outpatient wound care. I did some peds and home care, and I really just wanted to get as much experience as I could. So I'm wound care certified as well. But after all of that, then right as soon as I was finishing out my nursing home administrator role, and I had spoken for Ohio Healthcare Association as a presenter numerous times, and so the position came available. It seemed like a great fit. And 10 years later, I'm still here, still enjoying what I do, and still being challenged, which was always my question. I wanted to continue being challenged. So I've gotten a few more certifications.
You've got more certifications you're going to add too. It sounds like it. I don't feel like that sounds like it's letting up.
Yeah, any certification that we either develop or present to our membership through grants and other things, I try to take so that I can assist our membership and what it is and how to be successful with it. And I like school. I like learning, so it's never been a problem for me to continue to have that long term, that lifelong learning. So
Right. Now, I think that what that says is, the position in this organization, advocacy, you can't have advocacy, I think, truly without empathy. And so someone that knows, the space as intimately as you do and knows what it's like to be a provider of care, to me, that seems like that's perfect for the arrangement, perfect for you to truly have that member empathy so that you know how to advocate for what their needs would be. And when you hear someone, if you don't have that shared background, you might not hear it the right way. So I think that's important. That makes a lot of sense. And we're going to watch for more commas on your title on your LinkedIn, which again I'll include here in the video. Amanda, great chatting with you. I'm looking forward to the next time our groups interact here. And thank you. If you're watching this and have any questions for Amanda or for our group, click on one of the links right below us here if it's on YouTube or elsewhere. I don't think you'll have any problem finding us. But again, Amanda, thanks so much for chatting. We'll talk to you again really soon.
thanks.
Bye.